Hello and welcome. You're watching PRATIKAR, and today we have with us a very special guest. He is Dr. Rupam Borgohain. He is the clinical director from the Department of Neurology at the Yashoda Hospitals in Hyderabad. Welcome to our show, sir.
Good morning. Thank you very much.
So at first, if we start our show today, I would like to know from you what drove you in Parkinson's disease and movement disorders.
In neurology, মই যেতিয়া জয়েন কৰিছিলোঁ, this was basically untreatable. Most of the disorders treatment নাছিলে. So আমাক কৈছিলে কি neurology জয়েন কৰিলে তিনিটা কাম কৰে neurology. D. আমি ডিছকাছ কৰোঁ পেচেণ্টৰ বিহেভিয়াৰ, ডিফাৰেঞ্চিয়েল ডায়েগন'চিছ দিওঁ আৰু ডেক্সামেথাজন ষ্টেৰইডছ দিওঁ। তাৰপিছতে এই 30 বছৰত বহুত বেলেগ ট্ৰিটমেণ্ট ওলালে। চ' পাৰ্কিনছনছত মুভমেণ্ট ডিছঅৰ্ডাৰ্ছত বহুত বিশেষ ট্ৰিটমেণ্ট DBS ওলালে। দিছ ৱাজ around 2000. It was 1993, 2000. It is called the second miracle in Parkinson's disease after levodopa. So, iman bhal treatment ase ki patients get back 70 to 80%. Jo agote nasile, jo hioti no kuabo, koribo nuare. So, iman bhal hoy. Etu karone I was very fascinated and followed this for the last 25, 26 years. I'm doing this. So, बहुत बेलेग treatment करूँ, बेलेग patient और treatment दियो, भाल पाए, हेतु कारण that gives the greatest satisfaction to a doctor. Patient who is very badly incapacitated, family is also incapacitated, and after treatment they get much better, and patients and their families are satisfied. That is what makes a doctor happy. So, हेतु कारण मैं हेतु करी थाको.
Yes, and with that, like there are many, like in the state or in the country might be like, they don't know what is Parkinson's disease, like in particular. So how do you like describe it? How is the disease? What are the symptoms like in the patient?
So, we call it TRAP, tremor, rigidity, akinesia, which is slowness, and balance problems, postural instability. So, if you have 2 out of 3, we think you have Parkinsonism. Most of these patients have Parkinson's disease. This is predominantly a disease of the older people, 50, 60, 70, mainly 60, 70. But there are certain genetic types. Hiotok basic hunkale hoy, 30, 40, 20 loge hoy. So hiotok genetic Parkinson's disease thake. So these are the types which we see. We see patients walking slowly, we see them trembling, we see them bent. Hey to hey Parkinson's disease hoy. So that's how you make the diagnosis of Parkinson's disease. So there is treatment, but it is initially only with tablets like levodopa, syndopa or tridomet, whatever we give, the patients get better initially very well. Slowly the response comes down. From 6 hours it will become 5 hours, 4 hours, 3 hours, and at that time between the tablets they become slow, they become stiff, they have tremor. Sometimes even with the medicines they have a lot of extra movements. So these are the 2 side effects that you have, on off like a machine with the medicine tablet and without the tablet, and second is extra movements which we call levodopa induced dyskinesias. So these are the 2 main problems. After some time, which is 3 to 4 years later, when this becomes a problem, then we go back to surgery. Surgery is what makes patients much better. DBS is the treatment of choice.
Okay, and like is there any stipulated time period, like this is the time period where the patient will get recovered or something like that?
No, they get recovered whatever duration you do it in, but the earlier you do, the better, and they have a good quality of life. The good quality of life, the earlier you do, the better it is. Otherwise, hioti kosto koribo lage, khuskaribole, khabole, dress koribole, sob kamot slow hoy jay. So etu na lage, mane ajikali treatment DBS ot bahut bhal hoy, not 100%, 70 to 80%, but jiman bhal hoy, hetu karone they get a second life. It is actually like a rebirth. Most of the patients actually tell you that they are much better. So it makes you very happy.
Okay, like Zitya, when the disease gets to the high, when the movements are slow, when the people like they are very much stiff with their activities, so it like what are the early signs, initial signs, like this
Initial
is the starting?
Signs, yes, initial signs can be very subtle. Lot of people can have what we call premotor symptoms. They can have constipation, dreams in the night, they can have they cannot smell properly, they can have anxiety disorder. This can be 10 to 12 years before the slowness, stiffness and all that start. So it's the initial slowness and stiffness. What do you see it as? You see it as a reduction in their arm swing while walking. You see it as tremors. The arm will not swing as much one side as compared to the other side. This is what we think is one of the early signs. Other thing is you see the face becoming dull, not smiling, looking depressed. Then you see them having, while writing, the size of the writing becomes small. We call that as micrographia. So these things occur early in patients with Parkinson's disease. So once we can make the diagnosis of slowness and stiffness, we make the diagnosis of Parkinson's disease, the treatment is started.
Okay, so as you have said earlier, like this is the disease which is usually seen in the ages from 50 to 60 something. Like, but at present, what we see is like in every kind of disease, not only in Parkinson's or like diabetes, there are different kind of disease that we observe from a very small age.
Correct.
So, like, is Parkinson's also like that we observe it from a very young age?
Parkinson's is actually a lot of diseases put together causing this problem. So the genetic types where you have a single gene causing this in families, 2 or 3 members of a family, this happens in about 10% of the patients. These patients tend to be younger, much younger. They can start at 20, 30 also, and they can be much. The older ones are what have 90%, we don't have these single genes. We think they have genes which make them susceptible to the environmental toxins. Mane এই বাহিৰৰ যিখন আপোনাৰ ইনসেক্টিসাইড স্প্রে থাকে, দিস হেভি মেটাল আপনার ওয়েল ওয়াটার থাকে, দিস অল আর টক্সিক. সো আপনার যদি জিন থাকে আর ইউ আর এক্সপোজ টু দিস, দেন ইউ গেট ইট. দ্য toxins themselves alone cannot produce this. The genes themselves, the susceptibility genes themselves don't produce this. But if you have both of them, then you can get this. That is what happens in 90% of the patients.
And as it is a disease, everyone, if they come for the medical treatment, the very first thing comes to their mind is the cost of the treatment. So, like, what would you like to say on that? Like, how much cost effective, or what is the process?
This is costly, there's no doubt about it. But what happens is that the first few years you're taking drugs, and you take more and more drugs, the patient becomes slow, he has confusion, he's not able to participate, he has no initiative, he withdraws from society, comes down in his work. If you do this early, the medicines come down markedly by about 70%, 50 to 70%. When they come down, the brain clears up. People get back to their active lives. And there are doctors who are operating, there are doctors who are doing many things after their own surgery. So you give them a second life. The cost is a little high. In our side now it's costing about 14 lakhs to 15 lakhs for the simplest model, which used to cost 7 or 8 lakhs 20 years back. The price has definitely gone up. Also, that was the government sector and this is the private sector. So that way it's not too bad. The more expensive models are more expensive, but the battery lasts much longer, 20 to 25 years. Now what happened in our state, which was in the unified state of Andhra Pradesh, was that the government came to know about this, the benefits, and they made it free. They started funding most of the patients, poor patients could get it free. Now when the state split into 2 parts, Telangana and Andhra Pradesh, both the states are giving it free in the government hospital. So the point is that these are the smaller models, but if you want to get it done properly and you want a better team, more experience, then you have to pay a little bit more. So that's why it's more expensive.
And with regard to that, if we go for like when you started your journey, so how much medical sciences have advanced in this field?
Oh, it's remarkable. The improvement is remarkable. The difference is really a lot, because now we are able to do a lot of things for patients. People are able to get back to their jobs. As I said, there are people who are IT team leaders in Microsoft who got the disease. He was benched, he did his DBS, he is back to his job. So you get back to their job, they get 8 to 10 years of very good life, quality of life. It's not that the progression will not happen later, but it's much later. And as long as the battery is on, the quality of life is very good.
Okay,
so it's worth it.
And then like for a very simple, like a relatable question from our audience also, maybe like sometimes what we see as we are into a 8 to 10 hours of working schedule where we need to sit for very long hours, and then at times even our body gets stiffness, or we get those kind of things. So like these are not affected in this thing.
This is not a major issue.
Okay.
You can ask Mr. Bora as to how he was before and after. I think you can get an idea.
Okay.
Or you can let his wife say something.
হয়, আপুনি পাৰ্কিনছন ডিজিজ আপোনাৰ হৈছিলে, চ' আপুনি ট্ৰিটমেণ্ট ডক্টৰৰ আণ্ডাৰত কৰিছিলে, চ' আপুনি আপোনাৰ এক্সপিৰিয়েঞ্চটো কওকচোন, মানে কেনেকুৱাকৈ হৈছিলে?
এক্সপিৰিয়েঞ্চটো এই ক্ষেত্ৰত পজিটিভ মানে মই আগতে যিখিনি অসুবিধা পাই আছিলোঁ সেই অসুবিধাখিনি এতিয়া বৰ্তমান পোৱা নাই DBS কৰাৰ পিছত বিশেষকৈ মোৰ মানে যিটো আছিলে শ্লোনেছটো কমি গৈছে শ্লোনেছটো মই যথেষ্ট ভাল পাইছোঁ তাৰপিছত ষ্টিফ হৈ যায় যিকোনো জইণ্টবিলাক ষ্টিফ হৈ যায় বডিৰ এই ষ্টিফনেছটো মোৰ কমিছে গতিকে মূৰ ঘূৰাইছিল আগতে সেইটো এটা ডাঙৰ প্ৰব্লেম আছিল গতিকে সেইটো ক্ষেত্ৰতো দেখিছোঁ পজিটিভ ৰেছপন্স পাইছোঁ দৰৱৰ পৰিমাণটো তেনেকৈ কমি আহিছে যেনেকৈ আগতে মই 5টা চিণ্ডপা প্লাছ খাব লগা হৈছিল কিন্তু এতিয়া মই আধাকৈ 4 বাৰ দিয়ে তাৰমানে গতিকে সেই কম মেডিচিনত মোৰ চলি আছে কামখিনি আগৰ যিখিনি তাতকৈ ভালকৈ চলি আছে গতিকে মই কি ক'ম আৰু মানে যে খুব পজিটিভ ৰিজাল্ট এটা পাইছোঁ সেইটোৱেই থেংকছ ছাৰক ধন্যবাদ জনাইছোঁ
It's not me, it's the therapy. The therapy, if it is done well, it bhalke korile bhal result hoy. So it is a very highly technical job. Bhalke নহলে এই 1-2 millimeters এইটো হলে আপনার result ভাল নহয় এইটো কাৰণে experience লাগে এইটো কৰিবলে আমি দেখত সবতকে বেছি কৰিলো cases we have done more than 1000 cases in the last 25 years patients. So this helps. Experience is definitely important. Targeting to বহুত সৰু টাৰ্গেট 5 মিলিমিটাৰ টাৰ্গেট আপোনাৰ ইলেক্ট্ৰডটো তাত পাব লাগে আপুনি অলপ পেপিনে হ'লে ৰিজাল্টটো ভাল নহয় সো এইটো ভালকৈ কৰিলে বহুত ইম্পৰ্টেণ্ট
Okay, sir, I will get back to your 25 years of career. মই আপোনাৰ নামটো জানিব বিচাৰিছো আৰু
নৰেন বৰা
হয় আৰু আপুনি ট্ৰিটমেন্টৰ আগত আপুনি ক'ত কৰ্মৰত আপুনি কি কৰে
আচলতে মই কৰ্মৰত নহয় মই সেলফ এংগেজ
ওকে
গতিকে মই এডিটিঙৰ কাম কাজবিলাক কৰোঁ লিখা মেলা কৰোঁ সামাজিক এক্টিভিটিজৰ লগতো যুক্ত গতিকে এইখিনি আৰু
শ্বেয়াৰ কৰিব খুজিছোঁ দেই এইখিনিতে মই এটা কথা শ্বেয়াৰ কৰিব খুজিছোঁ কাৰণ আমি সামাজিক জীৱনতো থকা মানুহ সামাজিক সমস্যাবিলাকৰ লগত জড়িত আৰু তেওঁ হ'ল মোৰ জীৱন সংগী নৰেন বৰা তেওঁ ছ'চিয়েল এক্টিভিষ্ট ৰাইটাৰ এণ্ড এডিটৰ যাইখিনি হওক তাৰমানে মই দুটামান কথা মোৰ ক'বলৈ মন গৈছে কাৰণ এই বেমাৰটোৰ লগত মই দীৰ্ঘদিন ধৰি যুঁজি আহিছোঁ বেমাৰটো দেখি আহিছোঁ ঘৰতে মোৰ পেচেণ্ট আছিল আৰু প্ৰথম অৱস্থাত যেতিয়া মই দেখোঁ মোৰ খুব বেয়া লাগিছিল কাৰণ তেওঁ লাহে লাহে বেণ্ড হৈ গৈছে আখৰবিলাক একদম সৰু সৰু হৈ গৈছে ছাৰে অলপ আগতে কৈছে মাইক্ৰ'গ্ৰাফিক মানে হৈ যায় ৱৰ্ড মানে লেখাবিলাক তাৰপাছত আৰু তেওঁ কি হয় কথা ক'ব নোৱাৰে মই আনকি তেওঁৰ মুখত কাণখন দি কথা শুনিব লগা হৈছিল লাহে লাহে খোজ কাঢ়িব নোৱাৰে শুব নোৱাৰে ৰাতি বিচনাত যেতিয়া শুই থাকে উঠি আহি খোজকাঢ়ি থাকে চকুবিলাক ব্লিংক নকৰে চকুবিলাক মানে একদম ষ্টিফ হৈ মানে থৰ লাগি চাই থাকে ভাত খাওঁতে ভাত খাব নোৱাৰে একদম মই প্ৰথম অৱস্থাৰ কথা কৈছোঁ গতিকে তেতিয়া মানে আমাৰ মুখৰ পৰা লেলা উঠি পৰি থাকে অনবৰতে তেওঁ মুখৰ পৰা গতিকে তেতিয়া ভাত খাব পৰা নাছিল তেওঁ বহুত টাইম লয় চামুচেদিও ভাত খুৱাব নোৱাৰোঁ হাতেৰেও ভাত খুৱাব নোৱাৰোঁ তেনেকুৱা এটা অৱস্থা হৈছে খোজটো কাঢ়িবই নোৱাৰে বিৰাট ষ্টিফ হয় আনকি ভৰিত হাৱাই চেণ্ডেলযোৰ পিন্ধিব নোৱাৰে জোতা পিন্ধিব নোৱাৰে আৰু জেনেৰেল টাইপৰ মানে ভৰিত লগোৱা কিবা এটা তেনেকুৱা ধৰণৰ মই চেণ্ডেল কিনি আনি দিছিলোঁ তেনেকৈ দিছিলোঁ গতিকে সেই সময়ছোৱাৰ কথা মনত পৰিলে মোৰ খুব বেয়া লাগে তাৰপাছত আমি বাংগালোৰৰ নিম্হান্সত চিকিৎসা কৰি কিছু মানে ৰিলিফ পালোঁ যিটো ছাৰে কৈছে চিণ্ডুপা 110 তাৰপাছত চিণ্ডুপা প্লাছ মানে 125 ব্যৱহাৰ কৰিলে আৰু লাহে লাহে এটা সময়লৈকে দৰৱবিলাকে কাম কৰে কিন্তু তাৰপাছত কিন্তু কাম নকৰা হৈ যায় গতিকে আমি কেইবাবাৰো বাংগালোৰ গৈছোঁ তেনেকৈ সেইখন নিম্হান্সখন এখন চৰকাৰী ইনষ্টিটিউটেই বাৰু কিন্তু তাৰপাছত যেতিয়া আমি গম পালোঁ মই এই কথাটো মই দৰ্শকক জনাব বিচাৰিছোঁ এই কথাটো যে আমাৰ পাৰ্কিনছন পেচেণ্ট অসমত বা ভাৰতবৰ্ষত মহামাৰী নহ'লেও কিন্তু বহুত মানুহৰ মাজত এইটো আছে আৰু বহুতে তাৰমানে এইটো কিবা ভূত প্ৰেত কিবা মানে বেজালি এই ধৰণৰ মানে বেমাৰ বুলি ভাবে কিন্তু কথাটো তেনেকুৱা নহয় কাৰণ চকুৱে যেতিয়া ব্লিংক মানে থৰ হৈ যায় মানুহ এটা যেতিয়া বডিৰ ষ্টিফনেছ বা হাত ভৰি লৰচৰ নহয় তেতিয়া এটা ষ্টেচুৰ দৰে এটা মূৰ্তিৰ দৰে মানুহ গৈ থাকে গতিকে আমাৰ মানুহৰ মনত যিটো পুৰণি ভ্ৰান্ত ধাৰণা আছে গতিকে সেইটোৰ পৰা মানুহে এইটো বেলেগ ধৰণে ইণ্টাৰপ্ৰিটেশ্যনবোৰ কৰে গতিকে তাৰপাছত যেতিয়া মই ছাৰৰ কথা গম পালোঁ মোৰ এজন কলিগ মই ভেটেৰিনেৰী কলেজত চাকৰি কৰিছিলোঁ আৰু তেতিয়া ক'লে যে তেওঁৰ এজন ৰিলেটিভ তেওঁ হয় এজন ডেণ্টিষ্ট ডক্টৰ দিলীপ শইকীয়া তেখেতে গৈ পেলাই হায়দৰাবাদত তাৰমানে 25 চনৰ ছেপ্টেম্বৰ মাহত তাত গৈ পেলাই যশোদা হস্পিটেলত ছাৰ যশোদা হস্পিটেলৰ নিউৰলজি ডিপাৰ্টমেণ্ট আৰু পাৰ্কিনছন যিটো ডিভিজন আছে পাৰ্কিনছন ডিজিজ ডিভিজনৰ ৰিচাৰ্চ ডিভিজন সেই ডিভিজনৰ তেখেত প্ৰফেচৰ এণ্ড হেড লগতে ডাইৰেক্টৰ তেখেতৰ আণ্ডাৰত এটা ডাঙৰ বৃহৎ টীমে কাম কৰি থকা মই নিজে দেখিছিলোঁ গতিকে তেখেতৰ কথা গম পোৱাৰ পাছত আমি ছাৰক আমি হেল্থ চিটি হস্পিটেলত লগ কৰিলোঁ হেল্থ চিটি হস্পিটেল লগ কৰাৰ পাছত তেখেতে আমাক খুব মানে সাহস দিলে আৰু বিভিন্নজন পেচেণ্টৰ দিলীপ শইকীয়াক লগ পালোঁ তাতে আমি মজুমদাৰ বুলি এজন বেংকৰ মেনেজাৰ গুৱাহাটীৰে তেখেতক লগ পালোঁ তাৰ পাছত আমি পদ্মদাস বুলি এজন লখিমপুৰৰ পেচেণ্টকো লগ পালোঁ তেখেতক তিনিওজনেই তাৰমানে ডক্টৰ ৰূপম বৰগোহাঁই ছাৰৰ আণ্ডাৰত ছাৰৰ তত্বাৱধানতহে অপাৰেশ্যন কৰি তেওঁলোকে ভাল পাইছে মানে এইটো একদম ছিগনিফিকেণ্ট দেখিলে গম পাব কাৰণ আমি ইমান বেছি আপ্লুত হ'লোঁ পইচা পাতি খৰচ যথেষ্ট হয় কিন্তু হ'লেও পেচেণ্টে যিটো ৰিকভাৰী পায় তাৰমানে বেমাৰটো একেবাৰে কিয়ৰ কৰিব নোৱাৰে কাৰণ পাৰ্কিনছন কি কাৰণে হয় এতিয়াও তাৰ চ'ৰ্চটো মই ভাবোঁ মেডিকেল চায়েন্সে খাটাংকৈ উলিয়াব পৰা নাই বহুত বেমাৰে ওলোৱা নাই বাৰু তথাপি তেওঁলোকে যিখিনি ৰিমেডি দিছে যিখিনি মানে লাইফষ্টাইলটো তেওঁলোকে মেনেজ কৰিছে গতিকে সেইটো আমাৰ কাৰণে যথেষ্ট মানুহজনে ভালকৈ খোজকাঢ়িব পাৰে কথা ক'ব পাৰে লিখিব পাৰে পঢ়িব পাৰে কোনো মেমৰি লছ হোৱা নাই তেওঁ ডিপ্ৰেশ্যনো অলপ অলপ হৈছিল কিন্তু এতিয়া তেওঁ পূৰা মেমৰি আছে ধুনীয়াকৈ খাব পাৰে খোজো কাঢ়িব পাৰে গতিকে মই এইখিনি দেখি সঁচাকৈ খুব আপ্লুত ভাল পাইছোঁ আৰু অসমৰ মানে মানুহৰ যিসকলে পাৰ্কিনছনত ভুগি আছে গতিকে তেখেতসকলকো মই আহ্বান জনাওঁ যে তেখেতসকলে অন্ততঃ ডক্টৰ ৰূপম বৰগোহাঁইৰ দৰে বিশেষজ্ঞ পাৰ্কিনছন বিশেষজ্ঞৰ লগত যোগাযোগ কৰিব লাগে আৰু এইখিনিতে মোৰ এটা আহ্বান যে চৰকাৰলৈ দেই অসম চৰকাৰলৈ কৈছোঁ আনকি মই ভাৰত চৰকাৰকো এইটো কথা ক'ব খোজোঁ এনেকুৱা পাৰ্কিনছন পেচেণ্ট বহুত আছে গতিকে হয় ব্যক্তিগত খণ্ডত ইয়াৰ ব্যয়বহুল চিকিৎসা গতিকে কেনেকৈ এইটো চৰকাৰী খণ্ডত মানে কম খৰচত আমি ভাল কৰিব পাৰোঁ পৰিয়ালবিলাকত হাঁহি বিৰিঙাব পাৰোঁ এজন পাৰ্কিনছন ৰোগীক যাতে আমি পুনৰ যৌৱন ঘূৰাই দিয়াব পাৰোঁ গতিকে এইখিনি কথা আৰু ডক্টৰ ৰূপম বৰগোহাঁইৰ দৰে কেইবাজনো চিকিৎসকে ভাৰতবৰ্ষত আমি গম নাপাওঁ অসমতো নায়েই কোনো হস্পিটেল নাই আমিতো প্ৰথমতে চৰকাৰী খণ্ডতে কৰিব বিচাৰিছিলোঁ কিন্তু আমি নোৱাৰিলোঁ কোনো সুবিধা আমি নাপালোঁ আৰু আনকি ক'বলৈ বেয়াও লাগে বহুত শিক্ষিত মানুহেও এই বেমাৰটো সম্পৰ্কে গম নাপায় ইভেন মই নকওঁ আৰু ছাৰহঁতৰ প্ৰফেশ্যনৰ মানুহেও কিমানে গম পায় সন্দেহ আছে যাই কি নহওক গতিকে এইটো এটা প্ৰচাৰ হ'ব লাগে সামাজিক প্ৰচাৰ হ'ব লাগে আৰু তাৰ সামাজিক প্ৰচাৰেই নহয় পেচেণ্টে সুবিধাবোৰ কেনেকৈ পাব পাৰে গতিকে সেই ক্ষেত্ৰতো মই চৰকাৰ দৃষ্টি আকৰ্ষণ কৰিছোঁ মেডিকেল চায়েন্সে যথেষ্ট ভাল কাম কৰিছে আৰু নতুন নতুন প্ৰযুক্তিৰ জৰিয়তে মানুহক ৰিলিফ দিব খুজিছে যিবোৰ বেমাৰ যুগ যুগ ধৰি মানুহে কৈ আহিছিল যে এইবিলাক ভূত প্ৰেত বা ডাইনী যখিনীৰ কাম কিন্তু এইবোৰ আচলতে এইটো নহয় গতিকে এইবোৰৰ প্ৰতি মানুহক বিজ্ঞান মনস্ক কৰিব লাগে এইখিনিয়ে মোৰ ক'ব লগা কথা
So like as I've said it's been almost 25 years of you being in this field so you have seen different kinds of patients can you like define some memorable moments that you remember in your journey
See in this 25 years we try to make neurology from being basically not able to treat these diseases to introducing new treatments. I had introduced botulinum toxin, popularized this about 30 years back. Where this was one of the very major advances in neurology treatment. Then came the introduction of even things like what is called IV, intravenous thrombolytic therapy for stroke. So we had no treatment for stroke. We used to admit the patient, give them anti-edema measures and all that, but basically there was no treatment. So the first stroke therapy came in 2000, which was IV thrombolytic therapy, Actylis it was called. So I had started treatment, popularized it in the entire country, and that made a lot of difference. Now a lot of people are doing intra-arterial, which is 25 years later. So there's a big advance because stroke is one of the most dreaded treatments in Parkinson, in neurology. One day you're fine, next day you're totally paralyzed for life. So which is not funny. And that's what gives neurology a very bad idea that most of it you cannot treat. So now we are finding treatments for that sort of disease also, while we are also getting a lot of treatment for epilepsy. So things are getting better. And even untreatable disorders, though their treatment costs are very high, they are much better. So why DBS? As I told you, this is one patient where patient is totally incapacitated and you can get them back on the job doing their otherwise you have one family member all the time with the patient. That is the 24 hours and it's not funny. So patients get better. That's what my journey in 25 years has been, from a lot of untreatable disorders to a lot of things we can do for the patients and make them and their families better. That is what makes this journey satisfying.
Okay.
Also worked on things like the first new drug in Parkinson's disease in the world, which is a drug called safinamide. I wrote the original article for the entire world. 700 patients from the world trial was published. We published that in 2014. 80% were Indians, 20% were from Europe. That drug was the first new drug in Parkinson's disease in the world. It was an Italian drug, but we did the main clinical trial. And the FDA, the US FDA came down to inspect the data. They cleared the data, and the drug was approved for Europe in 2015, 16 and 17 by FDA. So this was the first time a new drug in a major disease in the world came from India, the original trial, and subsequently replicated. It's a very good drug. It was the first new drug in Parkinson's disease in 10 years in the world, and subsequently in the next 10 years also we don't have too many drugs. So that's how it is. So we do all that sort of work also. So you do not only DBS, other things also we do.
Okay, and as medical sciences have advanced a lot, so like what are the challenges would you like to list out in the field of neurological healthcare?
Neurology has the most untreatable disorders of all the disorders we have. We have a lot of diseases which are genetically based, which we are trying to find treatments for, and a lot of diseases we got Huntington's, the diseases are coming up, Alzheimer's, the classical example, very little treatment, though they are now getting some treatment, but most of it is actually untreatable, and that's the commonest. So we have a lot of untreatable disorders in neurology even now, and that needs treatment. We have a lot of genetic disorders, a cause for muscle diseases, nerve diseases. So all of it tends to come under, most of the difficult diseases come in neurology. So we are looking at advancements in genetic sciences to make this better.
Okay, and like as your patient also, they have also listed out something like these diseases are mostly the movement disorders, or in Parkinson's they usually they have the misconception of like different types of, like they are being possessed or somewhat like that. Like what are your views on that? Like have you ever come across something from your patient regarding that?
Yes, actually this happens even with epilepsy, because the first thing they do is they take them to the temple and they brand them all over the place, which is, they think it is all possessed by gods and devils and whatever. So it happens in Parkinson's disease also. They take a lot of other medications which doesn't really help. The same thing applies actually to even stem cell therapy. A lot of people get stem cell therapy which is not approved, which doesn't work in the vast majority of patients, and that is a big hoax that is going on in India. It is working in some diseases. It's not that it doesn't work, like in cases of where you do bone marrow transplantation and all that, but it doesn't work in the neurological diseases so far. It's not approved. The trials are going on. It's been going on for the last 30 years. And those people who are selling stem cell therapy right now are basically not doing the right thing for the patients. If it is not approved in controlled trials, it is not an approved therapy. So please, that it's not only other therapy, other treatments which are, even doctors have these problems which we need to sort out.
And then like for these diseases, as you said, no, they go for therapies, or so for that, for the clarity, as you have said, like DBS surgery is a thing which we go for Parkinson's. So can you please elaborate it to our audience, like in short?
What
like, yes,
See,
yes.
what happens in Parkinson's disease is that the dopamine cells die out in the substantia nigra. Now these cells, because they die out, the systems which are below in the circuit, they start firing excessively. These are two target areas. One is in the subthalamic nucleus and one is in the globus pallidus interna. They actually inhibit the rest of the movements. So the output from the thalamus to the brain and from the brain to the body becomes much less. So now what is happening, because these neurons are firing excessively, we put the electrode there and then drive this with electricity, and hopefully we reduce the output, and then the rest of the system normalizes. So your body movements become better and all that. That is a simple explanation. It is not so simple. It is much more complicated, but this is the simplest explanation that we can give as to what we are doing with DBS. So we are actually putting electrodes, connecting them to a battery under the skin, And that battery can last anywhere between 5 to 25 years depending on which one you go, but basically that's the system. As long as the system is working, you're fine. If that system goes off, you get back all the symptoms.
Okay. And for the symptoms, for the knowledge of these things, like how do you feel like awareness, how the awareness should be spread, especially in the smaller towns and the rural areas?
Basically, it's like this. The mass media has to take part. We have to inform them more and more, let them be aware of it. That's the only way they can get a very informed approach as to how to treat people. There is no other way of communicating to the patient and to their relatives and to the general population at large how to treat this except through mass media. That's about it. We doctors are confirmed with the patients, but we are not actually doing a good job. So now we are trying to do that.
And like in your hospital, when you treat the patients, like what are the benefits for the patients? Like how do you list out about that?
This is what they just now said, that all that they get back their lives, their stiffness comes down, they're able to move better, the medicines come down, the mind becomes clearer, they're able to get back to their work if they start early enough. If they are too far advanced, may not be possible all of it, but most of it can get much better.
Okay. So as you have treated many patients under you, and sometimes we see like we also get certain lessons from the opposite person. So like what, like are there certain kind of those lessons or like something, any valuable things that you have also learned from your patients?
Oh yes, the first thing is that they have a lot of difficulty and a lot of terrible time in their lives, and if we are able to help them, we should feel happy. If that stays with you, then you can be a doctor which you are helping patients. It's never about anything else but about how to help people in distress, help people in trouble. That is the first lesson you learn, because they go through a lot of difficulties, and if you're able to help that, it really makes a difference. That's for sure. That should be your prime goal and the prime thing, helping people in distress. That's one lesson you learn. Other things you learn, that there are, as you go, difficulties will be there. Your job is to keep doing the best you do, and somehow the system changes. As I told you, I was working in a government hospital. Government hospital has no equipment. So I was doing the drug trials, international drug trials. We generated the money, we bought the frames, we bought the machines to do this. And later on, the government of Andhra Pradesh and Telangana, that state, they had no money for anything. They started giving money for this expensive therapy free. So you just keep working at it, and that delivers somehow, translates somehow, people get to know about it even without you going to the government for money. And that was phenomenal at that point of time. So you just keep working and not look for the rewards. Your reward is helping people.
Yes, as you have said, so you also think like in other states also, at least the patients should get access to the treatment.
Yes, it can be done. If Andhra Pradesh and Telangana can do this, I'm sure most of the states can do this. The numbers are not huge. You can start with a few patients and see how it goes. You can limit that. But if you subsidize it and give it, then patients get much better.
And in your views, what is the future of the movement disorders in India?
Oh, we are doing a lot of work. There, we started the Movement Disorder Society of India. We also started what's called Parkinson's Research Alliance of India, and we get money to conduct international collaborative research. We get money from other sources like the GP2 and Michael J. Fox Foundation, and we are able to sustain international research and have publications.
And how your team works?
My team, we have collaboration with all other neurologists and both institutes as well as in the private sector, and we meet and we collaborate, collect samples, do testing in India and publish, which is what is difficult. In India, the academic activity is not emphasized so much, but we are working on that also, and we have international publications coming out quite regularly, which is important for doctors to be at the peak of their efficiency. You need to have collaborative research, you need to do science, you need to develop new things. We do that too.
Like as in India also, there are specialists like you, there are others who are like in every other day they are striving with new upcomings, new advancements, but still what we see, it's a true fact that sometimes what we see, people still they believe if we go abroad or if we go for higher treatment in abroad, like then only it is like mostly curable or mostly advanced
That
treatment.
is
Like,
not
what
true.
are your views?
That's not true. We can do most of this in India. It's true that the devices are made abroad, but even Indians are trying to make the device. It's not that it will not happen. The medical industry is growing quite rapidly, so this will happen in due course of time. We already have the best drugs being done in Hyderabad. Hyderabad is the drug factory of the world. Vaccines are done there, all the other drugs. So like this will happen in devices also. It's only a question of time.
And for people who want help, like who are seeking help for their Parkinson's disease, like how they contact you, like how can they get your treatment, like what would you say to our viewers for that?
And they can always approach me. I'm available here at Guwahati once a month at Health City, and otherwise I'm always available in Yashoda Hospital, high-tech city, and my number is freely available, so you can always get in touch with me. You can always approach me, and we'll see what we can do.
And for patients who are initially starting, like what would you like recommendations, like is there anything which for Parkinson's, like preventions, what they can do?
Right now we don't have any prevention for Parkinson's disease. We cannot slow down the progression of the disease. What we say is that if you get Parkinson's disease, be as active as possible, keep your body fit as possible. So as the medicines increase, we have a rule right now, which is the recommended therapy, to make it easy for the doctors to understand, to the patients to understand, is when you reach 5 to 1. That is means if you are taking 4 tablets of levodopa, you are fine. If you are taking a 5th dose, then you need surgery. If you are off for 2 hours and the symptoms are troubling you, tremor, rigidity for more than 2 hours a day, or akinesia, then you need surgery. Or if you have 1 hour of extra movements, you need surgery. These are the general rules. 5 to 1 is what we say for treating Parkinson's disease. There's also some other exceptions to that. If you have tremor which is not controlled with a high dose of levodopa, get your surgery done early. So we do it that way. But you need to have some symptoms before you get surgery done, as is the current knowledge now.
And as in this disease, the people, especially the patients who are dealing with it, they have to suffer a lot. But what we see, the relatives, the family, they also have to suffer a lot with the patient, because the patient, if the patient is also getting mentally depressed, the family members are also getting mentally depressed equally. So like how do you think how the family members should support the patient, or like how should they be very much patient with their own depression? Like what are your views on that?
It is very difficult for family members because there's a lot of caregiver burnout, stress related with this. So there is no dispute that this is quite a devastating illness and is quite troublesome. But what I would advise you is, please get your surgeries done early if it is required, so that the patient is mobile, patient is independent, and there is less burnout. Patients can have a healthier life. That should be the approach. A lot of people are scared of brain surgery. I have patients who I have counseled 16 years ago, and they come back and say, you told me 16 years ago to get DBS. They suffer for 16 years and 15 years and then come back. So that is not required. When doctors tell you, it is not the economic exploitation of the patient, it is what is benefiting the patient the most. Lot of doctors don't know about DBS. You don't blame them. We have failed to tell the doctors that this therapy is there for the last 25-30 years. Now we are telling them. They should realize that this is for the benefit of the patient, and ultimately we as doctors are working for that only. So basically you should look at that and concentrate on that and get it done early, so that the patient is independent, doesn't have so much of stress on the caregivers. That's the main thing.
And regarding the early Parkinson patients?
Early Parkinson's patients, you need to exercise a lot, work a lot, be fit as possible, and take care of yourself. This only helps a little bit. It doesn't really slow it down very markedly. And when the doctor advises you for the right treatment, you should get it done. You can also read about it. So that read it on, nowadays they're looking at Google and others, which is you look up the academic publications so that you have an idea. You should be informed about your disease. You should read about it.
And as you have said, like if a patient want to consult you, as you are available in Guwahati as well, are there special days or dates when you are specially in Guwahati?
I am specifically there on the 3rd Tuesday of the month. So that's the day to contact me, and you can always come and meet me. At the Health City Hospital, I'm there. You can always contact.
Okay, and like if we are like as we are approaching towards the conclusion, any message for the awareness and like for the people of Assam from you?
I would like to say that this problem is not confined to Assam. It's there everywhere. The same problem in everywhere is that the disease is already there. The patients are getting worse. The doctors are not aware that this treatment is available. I'm talking not about general doctors, I'm not talking about the medical specialists, I'm talking about the neurologists also. They are not aware of the efficacy of the therapy, how good it is. So you all should be aware of it. Look at this basic thing, what is approved for therapy, what is the treatment worldwide, and that is the way you should take it forward. So you can increase your own awareness. You don't have to depend on the doctors only. Look it up in the net, look it up in this thing, in whatever social media, look and see how you are informed. Be careful that everything on the social media is not correct. Verify it from the authentic sources and then accept that.
And as you have covered the social media sector, I would just take a minute from you. Like in social media, yes, what we see, there are different kinds of medicines, those we see in social media. There are different kind of exercises that people feel like, no, we don't have to go to the doctor. We can, like it's in YouTube, it's in Facebook, we can go for that.
That's not correct. That can be dangerous. There are lots of therapies which are advocated in social media which has not been cleared by the regulatory authorities. Whatever you do, you must make sure that it is approved by the regulatory authorities, then only follow that. Social media is okay for exercise, not so okay for giving all sorts of vitamin supplements and other therapies, because these are basically incapacitating illnesses and people are desperate to find any form of therapy. You have to look at what has been approved by the regulatory authorities, what the health authorities are approving, and follow those, not everything. So you use the social media to access that, but don't follow blindly everything that is there, anybody claiming anything. That is not correct.
Okay. Thank you very much, sir, for giving us so much insightful knowledge about like movement disorders and about Parkinson's, which are mostly many of us are not aware of the disease. And with that, as we come towards the end of our today's show, I would like to thank Doctor for giving us your valuable time, and also the patients for being here with us and also sharing your insights. Thank you very much. And here we come to the end. Thank you for watching our show.
Thank you.
আপুনি বাৰু হাড়ৰ সমস্যাৰ কাৰণে পাটনালৈ যাবলৈ চিন্তা কৰি আছে নেকি? এতিয়া আৰু চিন্তা নাই। আপোনাৰ যিকোনো হাড়ৰ সমস্যা হলে এতিয়াৰ পৰা আৰু পাটনালৈ যাব নালাগে, কিয়নো এতিয়াৰ পৰা গুৱাহাটীতে পাব সেই সকলো সা-সুবিধা। গুৱাহাটীৰ আমিনগাঁৱত অৱস্থিত পাটনা অৰ্থপেডিক এণ্ড মাল্টি স্পেচিয়েলিটি হস্পিটেলত কম খৰচতে পাব সেই সকলো উন্নত মানদণ্ডৰ চিকিৎসা সেৱা, য'ত অভিজ্ঞ চিকিৎসকৰ দ্বাৰা সম্পন্ন কৰা হয় বিভিন্ন ধৰণৰ হাড়ৰ অস্ত্ৰোপচাৰ। বৰ্তমানলৈকে 3000তকৈও অধিক ৰোগী সুস্থ হৈছে।
हमारे हॉस्पिटल में ऑर्थोपेडिक से रिलेटेड हर तरह का इलाज, जैसे कि जॉइंट रिप्लेसमेंट, ट्रॉमा सर्जरीज, स्पाइन सर्जरीज, इलिजोरोब सर्जरीज और की होल सर्जरी जिसको आर्थ्रोस्कोपी कहते हैं, उसका इलाज संभव है।
উন্নত মানদণ্ডৰ সা-সুবিধা থকা হস্পিটেলখনত আছে 3টাকৈ VIP ৰুম, 11টা কেবিন, জেনেৰেল ৱাৰ্ডত আছে 12খনকৈ বিছনা তথা 7খনকৈ বিছনাযুক্ত ICU। তাৰোপৰি এই হস্পিটেলখনৰ ভিতৰতে আছে ফাৰ্মাচীৰো সা-সুবিধা।